Mr. President, distinguished colleagues, I actually rise to support this motion. We do know that cholera has been a major issue in this country, although it's been brought to the fore in the Senate this morning in this motion. We know that every year it has recorded in large numbers of people have been affected. Even last year, we are aware that several thousands died and several thousands were affected. In the previous year, 2009 and 2008, we have had like number of cases. I think that in supporting this motion, it is also important to draw our attention to the very decaying situation that we have in our institutions. Because I do know that when I grew up as a young man in the primary school, we were taught about personal hygiene. And I do know that we do not take that thing seriously now. And it is known all over the world that mere washing of the hands with soap and water is able to reduce the incidence of cholera and other diarrheal diseases with up to 44% from the records of the UN. It came so bad that even the UNICEF, the United Nations Fund for Children, had to start sponsoring a program. And now yearly, on the 15th of October every year, we now celebrate what they call a Global Hand Washing Day. But after that day in Nigeria, what happens? In our schools, children are not being taught on mere simple hygiene. And it is not good for us. And beyond that, we're looking into issues of waste disposal. How do we dispose our waste? The mover of the motion just talked about the issue of the cholera epidemic coming more during the rains. In most of our rural areas, how do we dispose our sewage? Most of them do not have even the simple pit latrines, not to talk of the ventilated, improved pit latrines. So most of our people just go to the bush. And most of the times, when people have the cholera infection and they are using the bush, we expect that during the rains, the infection is going to spread. Because the whole thing is washed on, and before we know it, it gets into our drinking water. Because the sources of water are also not right. In this country, it is known that over 66% of our rural communities do not have access to safe drinking water. So these are challenges that we have. And our environmental health officers at the local government council levels. In the past, several years ago, I recall when I was the council chairman as far back as 1991, we had very efficient environmental health officers that moved from home to home to educate the people. That we see no more. The councils are no longer being proactive through their environmental health department to look into some of these things. And these are officers who are supposed to educate our people, so our people are likely ignorant. And with all this, things that we used to do in the past, we were proactive in the past. No, we are no longer proactive. And that is now causing a decaying situation. So that instead of improving on our health, we are now finding a situation where we are slipping back. And we are having a recurrent attack year by year of cholera. It should not be so, because it is not so in most countries who are already advancing. And beyond that, we're looking at our primary healthcare system. They should be the first port of call. They should be the people who will try to educate our people through the village health committees and the rest. They are no longer doing all this. Our people are no longer committed in their workplaces to doing the work that they should do. So I think that it is actually necessary that the Committee on Health should look into this and offer advice. It may not just be all about the Ministry of Health, because the Ministry of Health will intervene at the time when there is a crisis. But we need to look into how do we provide potable water, clean drinking water for our various populace, particularly in the rural areas. We need to look into how do we educate them, our parents, our women who are in the villages, who do not even know how cholera comes about, and that how to curtail it in case an attack does come in a particular place. We do not have to wait until things happen and we start rushing down with vaccines start rushing down with rehydration fluids. That should not be so. We should be proactive and then try to prevent the occurrence, the yearly occurrence of these attacks. And it is spreading, actually moving from place to place. So you cannot stop it. Now, it's not only occurring in Nigeria, where it's been found that within the Lake Chad Basin, all the countries surrounding there, Cameroon, Chad, Niger, and Nigeria. But the worst hit are Nigeria, Cameroon, and Chad. And people move within all these places. So we are likely going to have the attack come on us on a yearly basis. So we need to do something about our environment. We need to do something about the water that our people drink. We need to do something about health education. We need to do something about simple primary hygiene that is taught in the primary schools. I think it is time for us to get a little bit more serious about the health of our people and then become more proactive in trying to stop some of these diseases. So considering the very points that I have raised, I wish to second the motion as moved by the most distinguished senator from Ekiti. I so second, Mr. President.